All right, folks, I'm here with Audra and Max from the MaxLove Project. What a moving story that we saw yesterday. The advocacy,
Thank you.
the outreach, and even the personal story was so incredible. So maybe we could start, Audra. Like, what is the background? How did the MaxLove Project come to fruition?
It's such a good question. It started with this guy right here when he was at least he was like this high. He was 4.5 years old, and he was diagnosed with brain cancer. And we were told to focus on his quality of life. He has cancer of the brainstem, and so it's something that isn't highly treatable. So we just dove in, tried to figure out what could we do for his quality of life. And through his journey, which is really, really long, he's now 17 years old. So that gives you an idea. We were told that he didn't have a good prognosis, and he's here today. We found the ketogenic diet in around 2012. He was diagnosed in 2011 and dove in at a time of need. And when he went on the ketogenic diet, it stopped his disease progression in its tracks. It was incredible. So he was on the ketogenic diet for about 8 years, which is a pretty long time for a kid. It does not affect linear growth, as you can see.
Exactly. I was going to say, towering over everybody here, Max.
Yeah. So for us, the journey was very, very personal. But for me, as a founder, what happened was I found a calling. And I wanted to make sure that every family going through what we're going through had access to everything we had access to. So I was given a year off of work to be with him. I was a chef in the past, and so I knew how to cook. So I knew how to modify his diet. I knew how to create new recipes. And we decided it couldn't just sit with us. He was a victim of cancer. Our family was a victim of cancer in the moment it happened, but we were able to choose our response. And our response was to do something with it, was to take a tragedy and turn it into hope, was to make it do something for others, right? If we could even be a small little bit of hope and a progress for other families, then we've won. And so we started under that premise, like, what can we do to support other people? And so we met Victoria and Josh way back when, Epigenics Foundation, Quest Nutrition, and they've helped us enormously along the way through. He's had about 5 different disease progressions. So he's been through a lot, still has this cancer, and you've negotiated with it pretty well. It won't grow. Hasn't grown lately, so that's pretty amazing. But Victoria and Josh brought us into this community. They've supported us. They brought us into the Metabolic Health Summit. And what we love most about it is that this is where science meets society. And we're society. We're the people in need, and they have brought the science to us. And it's just been such a powerful community to be a part of. And it's done so much for our families and the folks that we serve in the childhood cancer and rare disease community.
And I gotta say, you are part of the science. Like I gotta say, like, there's one thing to know the data and everything, but as clinicians, when you see the stories, when you see the impact that it has, that is a big motivator to bring it to your patients, to bring it to more people. So you are part of that circle of science for sure.
That's amazing to hear.
And I'm so moved by everything you guys are doing. I want to map out exactly, like, when people tune into the foundation, like, what resources do they have at their disposal?
That's a great question. So you can learn more about us at maxloveproject.org, but for families, we ask them to join us at maxloveconnect.org. I'll say that again, maxloveconnect.org. That is the entry point to MaxLove Project for families. It is a private app and community e-learning space just for our families. And within that, we host cooking classes. We also have a cookbook, by the way. We have a keto course. We have keto coaching. We do nutrigenomics as well. And we also have emotional health care. So we work with the parents and caregivers. How can you show up for your kid, right, when you're experiencing such intense trauma yourself? And so we've also then jumped over into really the mental health and wellness space as well to offer amazing emotional health care support. We have an incredible community of parents, caregivers. We have an expert team of dietitians and psychologists and coaches and things like that to support families in the journey. I think the core of what we do, though, is that we're educators, and we really work on helping people resource themselves in the journey.
Wow. It's really the outreach, the level of lives that you guys are reaching, to me is something to be so proud of. And I gotta say, I'm gonna keep saying this. It was truly inspirational hearing about your story, how you're bringing food as medicine to so many folks and providing them with the skills, the education to be able to empower themselves. Like that's got to be, that was one of the, actually the key messages that I got too, that having that, like, that ability to take some control is huge for our patients.
Yes. Yeah. It's everything, right? I mean, you're sent home and you're told there's nothing you can do until you come back for infusion or you come back for radiation tomorrow or whatever. But we went home as parents and we're like, but we have him with us all of the time. What do you mean there's nothing we can do? Does his sleep not matter? Does his physical activity not matter? Does our mindset not matter? Does it not matter what we feed him? Obviously it does. And so one of the things that we do is we offer cooking classes in children's hospitals. It's revolutionary. Like, it's super cool.
Yeah,
and what we see happen there is that families come in, work with us. You have the smell of fresh food, right? I mean, that's like unheard of in a hospital, right? In a clinical setting. You have people manipulating food. You have tasting. You have enjoyment. And it feels like the kitchen table. It feels like the heart of the home. And families have said that to us. They said, you are bringing us home. And then the residents come in and the doctors come in and they're like, what's happening here? This is amazing. How can we have more of this?
I would be all over that, folks.
Right?
Yeah.
Right? And so it's even more than the the biological, physiological aspects to it. There is a soul, spirit, like mind-body connection thing happening in the kitchen, right? Like probably all of us, our earliest, most beautiful memories are probably in the kitchen somewhere, right? And so there's more to it than that. And then there's the social support and connection. We all know that's therapeutic, right? And so that in and of itself, and bringing people together in a hopeful, supportive environment, it's everything. So we're excited to be a part of what you're doing, which is to put more health and care into healthcare.
Amazing. What I love about it too is it's a holistic approach.
Yeah.
Like you're talking about the wellness, you're talking about the mental health, you're talking about nutrition. Like there's no stone unturned, which is really wonderful. So one last time, if people want to learn more about the MaxLove Project, how do they connect?
They can connect with us at maxloveproject.org, but also on Instagram. We are also on YouTube. We're on Facebook at MaxLove Project.
Tremendous. This is what you can expect at a Metabolic Health Summit, folks. Engaging stories, supporting the community. It is amazing. Thank you so much for joining us.
Thank you.
And we'll connect soon.